The authors granted journalists an early look at the results because of their potential importance in global public health debates. How is that not a scientific ethics violation? Hey, I am finally back, and I can record again, because I can talk enough to be able to record. You have no idea how crazy it's been. I've been so sick I couldn't talk. Anyway, it's good to see y'all again. I'm back. I got something fun to talk about today, because we're going to talk about COVID. But before we get started, I actually wanted to plug this up front. I hope you will come on over and join us as a supporter or as a member on sciworthy.locals.com, because this is where we talk about all things science. I am not actually the owner of Sciworthy. It's just a place where I like to hang out on the internet, because Locals is the most fun place on the internet. Much better than Facebook and Twitter and Instagram and all that jazz. It is so much better. But sciworthy.locals.com is run by Sciworthy, which is a organization, nonprofit organization that does nonpartisan science journalism. So becoming a supporter at as low as $3 a month, you're actually doing some charity work with that. So I encourage you to go on over there. I don't actually make any money off of it. I just think that Sciworthy is a great thing, so I'm plugging them for it. So let's get into it. What I want to talk about today is COVID. Actually, which makes sense since I've been sick, and no, I don't have COVID myself, actually. Just a cold. But this is going to be interesting. And YouTube, yes, I am not a medical doctor. I am a PhD scientist, though. I'm just going to be talking about this, just critiquing this, and will dare the YouTube strike hammer to come after me, because I'm not going to be saying anything that's against it. I'm just going to be critiquing what I find wrong with this article as I talk about it, because there are some things that when this article came across from the Washington Post, I found were concerning and quite possibly wrong. So we're going to do that, YouTube, and we'll see what you say. If you give me a strike, so be it. By the way, if they do give me a strike, I have a backup channel on Odysee that I'm building up, so you can go over there too. Anyway, from the Washington Post, massive randomized study is proof that surgical masks limit the coronavirus spread, authors say. Notice this says surgical masks. We'll get into cloth masks in a second. I'm not making any comment on that just yet. So yes, this was not yesterday. I think this was Monday as of the time of this recording. This was August 30th when this article was put out. The authors of a study based on enormous randomized research project in Bangladesh say the results offer the best evidence yet that widespread wearing of surgical masks can limit the spread of coronavirus in communities. Now, first thing, surgical masks, not the cloth masks that everybody loves right now. Surgical masks is what they're talking about with this. Bangladesh, also very different from the United States. Just to point that out, Bangladesh is not quite the same as the United States. And there's a mixture of studies out there. You can go read them. I'm not going to tell you. The preprint paper, which tracked more than 340,000 adults across 600 villages in rural Bangladesh, is by far the largest randomized study on the effectiveness of masks at limiting the spread of coronavirus infections. Okay, yes, that's a lot of people. Fair enough, that is 10% of the U.S. population. No. Yeah, it's what is it, 340 million. 340 million, so that's not 10%. That's way down there. That's a very small percentage of the U.S. population, but quite a lot, I think, in Bangladesh. It's a much smaller country. 600 villages. Rural Bangladesh. Rural Bangladesh is very different from the United States. The United States has a mix of rural and urban, so I would immediately question, were I reading this study, does this not... does this really apply in the U.S. when you're talking about rural Bangladesh, where you have a lot of social distancing as is because you're in a rural environment? Just saying. Just pointing out some things, YouTube. That's all I'm doing. I'm not contradicting the science. I'm just asking questions. And so be it. Strike me if you ask questions. If you have a problem with me asking questions, you'll just prove yourself a bunch of censors. Its authors say this provides conclusive real-world evidence for what laboratory work and other research already strongly suggest. Mask wearing can have a significant impact on limiting the spread of symptomatic COVID-19. Why is this Sure. Why is that lowercase? Anywhere I've seen it, I've always seen it uppercase. That's weird. The disease caused by the virus. Quote, I think this should basically end any scientific debate about whether masks can be effective at combating COVID at the population level. Okay. Excuse me. Still got a cold. Jason Abuluk, an economist at Yale who helped lead the study, said in an interview, calling it a, quote, nail in the coffin of the arguments against masks. Okay. Somebody who's saying this will end debate, I'm sorry. That's not a scientist talking to me. If you're saying it will end debate. It will end the debate! No, science has a lot of debate in it all the time. I'm sorry, I disagree with you. A. B. You're not a public health guy. You're an economist who led this study. You're the lead author. If you're one of the lead authors, you're an economist. You're not a public health person. I don't necessarily think you have the expertise to do that. This is why I'm like, YouTube, if you're going to argue with me about critiquing this when I'm a climate scientist looking at this is paper written by an economist. Or at least partially written by an economist. Guy doing the interview here. Researchers estimate that among the group of Bangladeshi adults in the study that were encouraged to wear masks, mask wearing increased by 28.8% after the intervention. Which actually isn't, well, depending on, here's a question. Question. How many were wearing before intervention? How many were wearing after intervention? Just saying it's a 28.8% increase doesn't mean all that much to me. It might mean a lot if you started with nothing. You know, if nobody was wearing a mask and you suddenly, oh, okay, well, we'll wear masks. A bunch of people decided to wear masks. But if you already had a lot of people wearing masks and a few more do, big deal. So I want to see, give me actual numbers. When tracked, this group saw a 9.3 reduction in symptomatic COVID-19 seroprevalence, meaning the virus was confirmed by blood work. So yes, there's some confusion and consternation around the PCR test and whether or not they show you have active virus. I've seen that somewhere. I'm not commenting on that. This is a good way to look at it, confirming by blood work. As well as a further 11.9% reduction in COVID-19 symptoms. Something about that doesn't ring right. But anyway, you're saying here that the masked group, see, this is confusing to me. And please give me your thoughts on this. But this is confusing. Researchers estimate that among a group of Bangladeshi adults in the study were wearing masks. So, the group that they were tracking, is that the whole population? Or was that the mask-wearing population? That's what's confusing the way this sentence is worded. I'm not 100% sure what they mean, because if they mean that it's the mask-wearing group that saw a reduction in COVID-19 by 10%. That doesn't really actually say a whole lot of good things. I mean, it did reduce it, but not by much would be the thing there. And I think they try to get to that point. The study's authors, led by principal investigators Abdullah Kwong, Luby Mubarak, and, oh God, I cannot pronounce that name, I'm sorry, a globe-spanning team that includes researchers from Yale, Stanford, and the Bangladeshi nonprofit Green Voice, emphasized that it did not mean masks were only 9.3 effective, 3% effective. Well, I mean, it depends, because I can't tell what group you're talking about in this prior sentence. And you're going to see in a minute why I'm not actually critiquing the actual paper, which is why I got a problem with this article in Washington Post to begin with. Let's see. I think a big error would be to read this study and say, oh, masks can only prevent 10% of symptomatic infections, Abuluk said. The number would probably be several times higher if masking were universal. Here's the thing. The fact that they're saying that makes me really suspicious of the reason why they're putting this out there. I'm not saying it's not good science. I'm just suspicious of the reason that they're putting it out there, YouTube. Cool your jets, YouTube. I'm allowed to express an opinion, and besides, it's going to go up on Odysee anyway. The study is peer-reviewed with the journal. Study is under peer... What? Wait, what? Okay, hold it. Study is under peer review with the journal Science. The authors granted journalists an early look at the results because of their potential importance in global public health debates. How is that not a scientific ethics violation? If it's under peer review and you're sharing the results with people prior to being approved, prior to being accepted for publication in a journal, how is that not a violation of ethics? What the fuck are you doing? Oh my God. That says to me that you had other reasons. I'm sorry, did Science approve of that? Did Science approve of you sharing the results before they even accepted it in Science? Because I know that that's usually a big problem in scientific ethics. Science, if you're watching, you know, that's not cool. That's a problem. To me, that's a problem. That's a big ethics problem. Why the hell are you giving journalists a look at this before you've even published the results? If you know you have it in peer review. It is one thing to present in a scientific conference, it really is. But why? The fact that you're sharing it with journalists says that you're trying to push a narrative in a particular direction. But fine, whatever. Independent experts that were asked to look at research praised its scale. Some suggested that it might be the most convincing argument yet for mask wearing. Incredibly challenging study to pull off. An emergency medicine physician, anti-mask people keep saying, where's the randomized controlled trial? Well, here you go. To be honest, I don't know that this is a randomized controlled trial because I haven't seen the paper yet. I want to see the paper myself. I want to make that judgment on my own. Thank you very much. And besides, that randomized controlled trial doesn't give the other argument any merit. It doesn't take away the other argument about personal choice and freedoms. But of course, you all just say that that's selfish if we want to make our own choice about wearing a mask and evaluate our own risk and all that. Whatever. It's not just modeling or looking back at studies. Lawrence Gosson, O'Neill Institute. This is the gold standard of scientific knowledge. Yeah, we'll see about that. Again, I'm highly suspicious because you're talking about rural Bangladesh, and I really don't think that applies in the U.S. The research is an ongoing part of a project by Abeluk and his co-authors. Again, Abeluk, for the record, remember, Abeluk is an economist. He is not a scientist. He is not a public health professional or an epidemiologist. He is an economist. Thank you very much. I'm going to blame the cold that I can't talk. Team chose Bangladesh because co-author and Yale economist. Again, economist. These are not public health people. What the hell? Mubarak was from the country and had worked there before, and because of increased options for funding. You know, I mean, okay. You're not supposed to count professional affiliations. And yes, you can do good science. So again, I want to see the paper. But at the same time, I am immediately suspicious when the people doing a public health study, and don't get me wrong, I believe there are others on the study who are public health people. Those are the ones I would prefer to see up in front. But for a study like this anyway. But if it's led by economists, it's a public health study, randomized trial of masks in Bangladesh led by economists. Something doesn't compute. I'm just making a comment on that, YouTube. I'm not saying it's not possible. Just a comment on that. Sheer scale of the project, which began in November and concluded in April 2021, is notable. 178,000 Bangladeshi villagers were an intervention group and encouraged to use masks. An additional 163,000 were in the control group, and no interventions were made. The project assessed the levels of mask wearing, physical distancing through direct observations from plainclothes staff in the community at mosques, markets, and other gathering places. Hundreds of people involved in, well, great. You know, I'm glad you had hundreds of people involved in that. Mask wearing had been mandated in Bangladesh since March of 2020, though adoption remained limited. The researchers found that they were able to increase mask wearing in the intervention group from 13% to 42%. Okay, that's impressive. You answered my earlier question. The effect was observed and found to be consistent over 10 weeks and persisted after interventions ended. The group credited a cocktail of 4 interventions that helped substantially increase mask usage in the community, providing no-cost masks delivered door to door, offering information about the benefits of reinforcement of mask endorsement by trusted leaders. Yeah. There's a precise combination of these things. When those behavioral findings were released earlier this year, they received positive response from experts. Okay. I got a curiosity question. You received positive response from experts. Which experts didn't look at it positively? And did the public look at it positively? Because I'm presuming because this is getting pushed publicly, you must have pushed the other study publicly. So how positively received was the previous stuff by the public? And I don't think this was very positively received because I think some of the comments in here are quite interesting. Probably something I cannot show on YouTube. I see no reason why the interaction between the mask and the virus will behave any differently in rural Bangladesh or in rural Kansas or urban New York or San Francisco. The biology is the same. Biology is the same. Culture is not. I see a very big reason why it wouldn't behave the same. The culture is not. The culture is very not the same between rural Kansas and rural Bangladesh, nor is it between urban New York and San Francisco and rural Bangladesh the same thing. I do not see that. That would be an incorrect statement. I do not think so. Biology may be the same, and yes, the interaction would be the same. If the biology is the same, the interaction will be. But the culture is not. And where we're interacting, what we're doing, and how, touching and feeling and moving around the mask and wearing it properly and being careful taking it off and all that jazz. No, not. So, yeah, biology is the same, and it should be. But you're ignoring some confounding variables in there, and I'm going to say that, and I'm just commenting as a scientist, YouTube. I'm not saying it's not possible. I'm not saying this is not a good study. I also want to see the actual study, but hey. Let's see. Study contains a trio of key observations. One, it offers more evidence that masks work to shield wearers and the community. Because the research team was only able to document cases in which people were symptomatic and were seropositive, Randy agreed the results may be an underestimate. We'll see. Indicates that better quality masks offer superior protection is the other one. And shows how the study shows how to motivate people in a community to wear masks by making masks a social norm. That's the thing. You might want to figure this out. There's a lot of people who don't want that to be a social norm. And also, how would you counter it with the studies that have been showing that this can have serious mental health problems to be forced to wear a mask all the time and not be able to express yourself? Just to make a point on that. There's some confounding things in here that need to get worked out. And that's all I'm saying, YouTube, is there's some confounding things about this that need to get worked out. And I don't think it's necessarily a good idea to make being able not to express yourself a social norm. Because you're wearing a mask anyway. But again, YouTube, my opinion on that. Go ahead, strike it, I dare you. We'll see what happens. I probably did get struck by this point. Gostin has the research. The study does not quite claim to be the final word on masks. The authors found that while cloth masks clearly reduce symptoms, they cannot reject the idea that unlike surgical masks, they may only have a small effect on symptomatic coronavirus infections and possibly none at all. So this is the point about cloth masks. That really those cloth masks that people have been wearing don't work. And they're saying it. They're saying it, YouTube. They're saying it. They're saying it. Not me. Wait a second. Study does not quite claim to be the final word. The authors found that while cloth masks clearly reduce symptoms, they cannot reject the idea that unlike surgical masks, they may have only a small effect on symptomatic coronavirus infections and possibly none at all. That the Abuluk emphasized, however, that research did not produce evidence that cloth masks are ineffective. Boy, are you splitting hairs. You basically said they're ineffective up here, and then you're saying they're not ineffective down here. Great. The results don't necessarily show that surgical masks are much, much better than cloth masks, but we find much clearer evidence of the effectiveness in surgical masks. That's a contradictory statement. This is all contradicting, because right here you said, while cloth masks clearly reduce symptoms. Question. If you are showing symptoms of COVID-19 and you test positive for it, yeah, did it really stop you from getting the virus? Just saying. Oh, goodness. Also noted that the intervention group was found to practice more social distancing, which may complicate the findings in masks. However, he noted that in locations such as mosques, where many participants worship, there was no physical distance along with poor ventilation, but there was increased mask wearing. Authors plan to conduct more research, including an evaluation of how masks limited symptomatic spread, whether by decreasing the viral load so few people experience symptoms or by preventing infections entirely. But existing research could have a significant impact on future policy and may raise questions about past policy. In this research, people were given masks and told they were expected to wear them. Randy said something similar almost transpired in the United States in April 2020 during the Trump administration. The Postal Service made plans to send 5 masks to every American household, but the strategy was abandoned. Yeah, you know what would have happened in the U.S. if you had sent 5 masks to everyone? There would have been a lot of them that would have not been used. Just saying. One of the things I wonder, if we had all been sent masks in the same way as the participants in the study were, would we have decreased the death toll from COVID? You can't possibly know that. To be honest, you can't possibly know that. There's so many different things about the U.S. and the way it is here. That's why I question whether or not the Bangladeshi study here that they have is going to be as meaningful in the U.S. But that's it. I've made my comments on it. And really just expressing my opinion and asking some questions and commenting on this particular paper. I think it is pretty damn unethical that you are sharing all this with journalists and sharing your result with journalists before publication. You know, I think that's pretty damn unethical. Yeah, you didn't have figures in here, but you had numbers that were probably in your study. And that's pretty damn unethical to do as far as science goes. So that's it. We'll see what happens with this. But again, I'm going to put this on Odysee too. So we'll see. If YouTube doesn't like it, Odysee will have it. Anyway, I hope you all like this video. Go over to sciworthy.locals.com, of course, and become a supporter there, as I mentioned. But if you like this video, hit the like button on your way out. Share the video, comment on the video, subscribe to the channel. And until next time, I'm Adrian. I hope you stay curious, my friends.